According to the Centers for Disease Control, approximately 1.7 million hospital-acquired infections occur in the U.S. each year, resulting in 99,000 deaths and an estimated $20 billion in healthcare costs. There are many other types of infections that people will experience throughout their lifetime. At Pulse Center for Patient Safety Education and Advocacy, we have found that the people who have had life-changing or near-miss experiences with healthcare, either themselves or with their loved ones, may often be the best teachers. Here are some of their stories.
My mother, Peggy Lillis, was a 56-year-old public school teacher living in Brooklyn, New York. In April of 2010, she went to her dentist for a root canal procedure. Following the root canal, he decided to give her a prescription for clindamycin to ward off any sort of infection prophylactically. She was taking clindamycin for several days when she, one night, Thursday night, she woke up and she had pretty urgent diarrhea. She was very lethargic. I just assumed at that point that it was dehydration. The EMTs took her blood pressure, and her blood pressure was 70/40. About an hour after we got to the hospital, the ER attending, the infectious disease attending, and a surgeon asked to speak with us. They inform us that our mother has a life-threatening infection called Clostridium difficile. At that point, I had never heard of this before. That her white blood cell count was over 40,000, which is incredibly high. That they were doing a test to confirm their diagnosis, but they believed that she had toxic megacolon, which is a life-threatening outcome of having C. diff. And we were stunned. We just assumed that she was fine, and to be told, taking somebody to the emergency room to get them some IV fluids and be told that they have a life-threatening infection is a pretty, it's a body blow. It was the beginning of our education in what C. diff and other healthcare-associated infections and antibiotic-resistant infections are doing to folks in our country. The infection was too great, and the sepsis basically took her. It was really difficult to believe that something like this could take her out. I think part of what started us down the road to activism is, number one, our mother raised us to stand up for people who couldn't stand up for themselves. And she was no longer here, and she couldn't stand up for herself. So it was on us to stand up for her. And the more that I looked into C. diff in the days and weeks after her death, the more I was astounded that this disease existed that was killing tens of thousands of Americans every year. At that point, it had just eclipsed HIV as a cause of death in the United States. It kills more people than drunk driving. And for this disease to exist and for us to have never heard of it was completely outrageous to me. The Peggy Lillis Foundation is building a nationwide C. diff awareness movement by educating the public, empowering advocates, and shaping policy. Our goal is to reach a day where C. diff is rare, treatable, and survivable.
I ended up with MRSA in 2007 after having an ankle replacement, which left me laid up for 3 months with an open wound that was, this big in my ankle, and it had to close from the inside out. I was on antibiotics, IV antibiotics at home. I didn't get any information prior to my surgery about infection. They always say that's a possibility when you sign the form, but I didn't know what I know now. I get the cast off 3 months later after one of these surgeries, and within 2 days I could barely walk. I ended up on the IV antibiotics again, in a hospital bed for the whole 6 months in my living room. It took over my life. And I'll tell you, emotionally, physically, spiritually, I felt bankrupt in all those ways. And I even felt the pressure of seeing my family have to do everything for me. It puts you in such a vulnerable place. I can't explain it other than you just really feel helpless and dependent on everybody who was already stressed out. I went to specialists at other hospitals. I talked to people who had amputations, and I decided to have a below-the-knee amputation. medication. It was it was an odd thing. My daughter was taking me to my first doctor's appointment after the hospital. I went to cross my legs, and there was no leg to cross, and I burst into tears. And but ever since then, I haven't looked back. My kids had a party for the saying goodbye to the leg because they decided to look at it as a new beginning for mom. You can push back. You can go and be an advocate. And I was able to do that.
My father was 86 years old. He had been living with our family. He developed some severe back pain, so that when he would get up out of bed, I could hear him gasping. So I took him to the doctor, and his primary care. Also in the hospital, he developed VRE, which is vancomycin-resistant enterococcus. It's another hospital-acquired condition. It is difficult to go into a place and see the subtle issues. For example, the place my father was in for a while was 5 stars. It's now been knocked down to 4 stars. But at the time, it looked good. It didn't smell bad. And that was what was so confusing. This was supposedly one of the good ones. It never occurred to me that a hospital and nursing home, which you would think would be so sterile, so to speak, that they would keep it really clean, is actually a breeding ground for some of these infections because they're so easily transmitted. I mean, you take a chart, put it down on a counter, which could be infected, and then go into a room, shake someone's hand, they rub their eyes, boom, there it is.
In 2006, I was given the antibiotic Levaquin for a suspected sinus infection that I ended up not having. And about a month later, I was walking across a parking lot and I could feel something in the back of, I really thought someone kicked me in the back of my leg. And it turned out that I ruptured my Achilles tendon about a month after I took the Levaquin. I ruptured my Achilles tendon 3 times. And by the 3rd one, my surgeon was the one that connected it and said, this isn't normal for someone your age and someone with your lifestyle. So let's go back and let's try to figure out why you're rupturing so much. Because 1 is weird, 2 is you have really bad blood, and 3 was there's something really wrong. So we went through my medical history, and I told him just kind of in passing that I took Levaquin, and he put his pen down and he said, that's it, that's what's doing it. The FDA recently, last year, came out with a directive that said fluoroquinolone antibiotics such as Cipro, Levaquin, Avalox are too risky with their adverse reactions to prescribe for routine minor infections. So if you go into your doctor and you have a sinus infection, you have a UTI that's uncomplicated, say, is there something safer? Because Levaquin, Cipro, and Avalox are too strong to fight these minor infections. They're meant for severe infections like pneumonia or anthrax, and they're really inappropriate for these smaller infections. So really be aware of what you are being prescribed, and if you're not comfortable with it, or if you know that there's adverse reactions that are attached to this, ask your doctor for a safer alternative. The safe bet is if you have the symptoms that we list on our website, there's a good chance that you've been affected by this antibiotic.